Ladies and gentlemen, dear colleagues, I'm coming from Orthopedic Hospital Valdoltra. I'm going to overview the basic tribological principles in total hip arthroplasty and the related problems in various bearings, focusing on ceramics. Well, we all know that hip implants fail. This is our yearly collection of failed total hip arthroplasties. And as you can see on this very busy slide, they can fail in a very different ways. And actually, a lot of failure modes are related to material and especially failures related to tribological issues. When considering tribology, we need to know that there are two basic states in which a total hip arthroplasty can be. And it is while we are moving around, so when surfaces are rapidly sliding one against the other, and the other is while we are standing still or moving only slowly. The first one, 90% of the studies are dealing with this one. This is not studied at all. Well, there are few types of wear, among which abrasion wear is the most frequent. It is easy to understand how the asperity from one surface removes material from the other. Third body wear, you can see that the third body causing damage and wear when it is trapped between the two surfaces in motion. And this is a picture of abrasive wear, and on the right side you can see the picture of the carbide particle damage produced on a metal surface. And this is a couple of interesting cases of third body wear due to ceramic particles embedded in the polyethylene material, which caused extreme wear of the head, as you can see, but on the other side protected the plastic for being worn out. There is a third type of wear, is adhesion wear. It is like when material is spread from one surface to the other, as you can see on this side, as butter on bread. It is a more rare type of wear. The next issue in tribology is lubrication. There are basically two types of lubrication. It is a boundary lubrication and fluid film lubrication. The matter is actually much more complex than that. But nevertheless, we can stick with those two. Boundary lubrication is taking place when the lubricant is just adhered to the surfaces. It promotes or eases the gliding. Nevertheless, asperities come into contact and load is carried by the asperities. The other type of lubrication is fluid film lubrication. What happens here? Well, in this type, the surface during motion traps the viscous fluid between the surfaces, and the load is actually carried by the liquid and not by the surfaces themselves. But nevertheless, when we stop moving, the liquid is squeezed out of the joint space, and there is again boundary lubrication. So we need a certain amount of motion. It is a complex equation, which is actually not important, but just showing that there are several factors that influence the thickness of the fluid film. And it is the viscosity, angular velocity, head diameter, as you will see, and mainly diametrical clearance. And then we can calculate the lambda equation. Lambda equation is simply the ratio between the thickness of the fluid film and the asperity high. So it is obvious that the higher the lambda, the more we are toward the fluid film lubrication on the Strybeck curve, and the less wear we have. So, with metal on poly and ceramic on poly, lambdas are low. So there is always boundary lubrication and wear is high. Instead, in hard-on-hard bearing, especially ceramics, which can be very well polished, lambdas are high, and during motion we are towards fluid film lubrication, but again only during motion. Clearance is one of the most important issues in tribology. Clearance is actually the difference between the diameter of the head and the inner part of the socket. As if you remember the equation, the lower the clearance, the better the lubrication regime. But on the other side, if clearance is too narrow, it can occur that sudden clamping, sudden increase in frictional torque occurs because of slight deformation of the socket. And it was actually the basic failure mechanism for the old McKee-Farrar prosthesis, and it is one of the mechanisms for the socket failure in resurfacing in, for example, Australian registry. Surface finish is obvious. The higher the surface finish, the higher the lambda, and the better the lubrication. It is important to note that polyethylene can be only smoothened to a certain extent and not nearly as in hard bearings. So to overview this tribological phenomena, we can say that in metal on poly and ceramic on poly, no matter whether we are walking around or standing still, wear is always directly proportional to sliding distance, which means that increasing head size, we increase sliding distance and we increase wear. On the other side, it is a different issue in hard-on-hard bearing, and it is during motion, we are nearly into the fluid film lubrication because of these better properties of the material, and there is nearly no wear. But while we are standing still and slowly moving around, we are again in boundary regime, and wear is directly proportional to sliding distance. So increasing head size, we improve this, but it's already good, but we deteriorate this. So the final result is actually depending on the activity pattern of the patient. And actually there is probably an upper tribological limit of the head size, which is probably not more than 36 in hard-on-hard bearing, and probably even less than that in metal or ceramic on polyethylene, even though we like big heads because of other issues. Actually, in metal on metal, the tribology is very good. But nevertheless, we were among the first to publish that metal on metal is inferior to metal on poly, mainly because of other or new failure modes that were introduced with this bearing, especially corrosive phenomena that produce toxic reaction around metal bearing, and metal allergy can also be an issue here. With crosslink poly, we must take into consideration that crosslink poly particles are much more toxic than conventional polyethylene particles, and they are smaller. So if we increase head size and take into consideration these more toxic particles, we partly offset the beneficial effect of the better wear performance of this polyethylene. So it is again advisable not to exceed with head size in crosslink poly. Well, ceramic on ceramic, we've been having a big series in ceramic on ceramic since early 90s, and actually there are nearly no tribology related problems. So with ceramic on ceramic, tribology is optimal. And what is even more interesting, that also septic revisions are, at least in our hospital, 3 times lower than in metal on metal and 2 times lower than in metal on polyethylene. And I assume that it is probably that ceramic particles are very inert, producing a very healthy environment around the hip, and those low grades that would become clinically manifest do not become with ceramic on ceramic bearing. But there was a problem with alumina ceramic, and the problem was fractures. We had quite some fractures, and we did a fracture analysis that was published this year, and actually most of the fracture came out to be multifactorial. There was some material-related problem, not on the ceramic side, but on the socket side, but we found a lot of surgical-related problems. So something trapped between the cone and the head and things like that. Nevertheless, in the last 5 years, we follow 500 plus patients with the composite ceramics right now, and with the same surgeons and the same patient and the same hospital, we haven't seen a fracture in this series, and we follow our patients 100% since they don't have anywhere to go. Squeaking. Squeaking is of course a tribology-related phenomena. It's caused by dry contact and edge loading. And the problem is that it is mainly in the US, because in the States, surgeons are much more inexperienced than in Europe, and that's why they place sockets in very poor positions. That's why the incidence of this dry contact is very high. So this is the boundary lubrication in ceramics, which would not occur in optimally placed socket. But you need an amplifier, and especially with the particular type of stem, it was relatively soft titanium alloy that amplified the sounds so that they became audible. Actually, with increasing head size, it is important to note that we increase frictional torque. Frictional torque not only influences the interface between bone and implant, but also between head and the taper. That's why we are facing taper problem more and more. It is more frequent in metal on metal, but we see taper problem also with ceramic on metal with extremely large heads. Thank you very much for your attention.